Hi there. Welcome to the While You Wait podcast, where it's all about helping women just like you learn about the bladder while you're waiting for your appointment with that specialist. Each week, I'll combine science, medicine, and common sense so you can learn, become empowered, and get started on your journey to dryness. I'm your host, Dr. Sarah Boyles, a board-certified urogynecologist. Let's get started. Hi there. I'm doing something a little bit different this week. I recently did a lecture for my PFM on radiofrequency and laser treatments of the vagina. I get asked lots of questions about these treatments. There's lots of advertising about them, and they sound like they are just too good to be true. But what's the real information here? So I took this lecture and I converted it into a podcast for you. The lecture was for providers, so some of it may seem a little bit technical, but I still think there's a lot of great information here. I hope you enjoy it. My name is Sarah Boyles. I'm a urogynecologist here in Portland, Oregon. I practice clinically, but I also really like to educate. And I think that this is a topic that I get asked about all the time. A lot of my patients are really interested in laser radiofrequency and what it can do for the vagina and kind of pelvic floor health. I think that this is a case where there's a lot of marketing and a little bit of science. And so I'm really going to talk about the data and the hype that's here. And just so you know, laser and radio frequency, they're also called energy-based devices. So I may use that term every now and then. So I just wanted to start by saying that I don't have any disclosures. I don't have any biases that would impact this information for you. And this information is really educational. It is not meant to be medical advice. I would tell you that for me personally, I would really like these devices to work. I think it would be a great additional tool for us to have. And so that's kind of where I start with this information. So I'm going to talk to you about what a laser is, and then the associated outcome data on pelvic floor health, what radiofrequency is, and then the outcome data, and then a little bit about an FDA statement that came out about energy-based devices. So I think we see a lot in the media and in marketing about laser devices, and this one is on a particular device called the Mona Lisa Touch, which is a particularly popular one. They're always, pretty beautiful and fancy looking, which is a sign that usually they're a little bit more marketing than scientific, because doctors don't put a lot of time into marketing. And there's usually, an active looking woman, and then, something that says something like improve your gynecologic health. There's a lot of use of the term rejuvenation, so rejuvenate your feminine health. Vaginal rejuvenation and vaginal lasering are basically synonymous. There's a lot of talk about self-esteem and confidence and restoring those things, and who wouldn't want that? And then vaginal concerns, right? There's frequently kind of a romantic component that's put in there. And we also see this, in kind of the lay media, right? So Khloe Kardashian has said, my sisters, they've had kids. There's a vaginal lasering thing to tighten. So in my household, all they do is talk about this vaginal laser. It's like their discussion back and forth. There have been multiple women on the different Real Housewives shows who've had this and have talked about it. And then Jada Pinkett Smith came out and said that her vagina felt younger after 3 rejuvenation treatments. And that was back in 2018. So, this is in our media all the time. These are things that we hear, and it all sounds really great. So, but what is laser? Let's talk about the data behind this and just kind of forget about the marketing. And I laughed when I put these slides together, because you can tell when they get scientific because they're much less beautiful. So laser is an acronym for light amplification by stimulated emission of radiation. And this can get a little bit technical, so just bear with me. So in a laser, you have a specific medium. That medium is activated and it emits a wavelength of high energy light. There are different types of lasers, and each type is named after the medium that's activated. So in gynecology, the most common lasers are a CO2 or a carbon dioxide laser and the ERG-YAG laser. And there are different commercial brands that you'll hear: Mona Lisa Touch, FemLift, Intimalace, and all of these use slightly different technologies.
each medium releases a different wavelength of light, and that means if you have different types of procedures, you may notice that the light will be a different color. So sometimes it may be green, it may be red, it may be a blue-green. And this is all really important because each type of laser acts a little bit differently on the body. And different parts of the body require different settings depending on the type of tissue that's being treated. So for example, the vaginal tissues are much more delicate than your skin. And the laser that you would use for a tattoo removal, for example, would be very different than one used for the vagina. So when the laser is focused on the body, it interacts with your cells by a process called photolysis. So photo means light and lysis means destroying the cell. So the laser causes a targeted cell injury. A controlled injury of the skin encourages collagen production and it results in skin tightening, and that's really what we want in these procedures. Different types of lasers target different layers of skin, and so it's really important that the right laser is used in the right way in the vagina, or there can be resulting burns. So the trick here is to increase collagen production and skin tightening while avoiding burns. And so you really have to be careful about the laser and the settings that you're using. So what might lasers help with? So there's good scientific grounds to believe that lasers could help with urinary incontinence, with sexual function, and with genitourinary syndrome of menopause. So that is kind of a drying of the tissues, decreased lubrication, vaginal irritation, pain with intercourse because of that lack of lubrication. So because the tissues can be tightened, theoretically the urethra could be resupported and this could help with leaking. The vagina could be tightened and this might help with intercourse. There could be an increase in collagen and cell growth, and this could improve tissue quality and lubrication. But it's important to remember that because the different lasers work in different ways, and a lot of the studies are pretty small studies that are done with different types of lasers, it can be hard to aggregate the data. And the other thing that I would tell you is that at present, none of these devices are approved by the FDA for any of these conditions. And it's just important to note that devices are approved by a different mechanism than medications. And if these were medications, they would not currently be cleared by the FDA for any of these indications. So we do all of these treatments off-label, and that is something that is acceptable, but it's just important to know that onus of data isn't there at this point in time. All right, so let's start with urinary incontinence and look at that data. So what happens when we're initially investigating things, that there are small studies that are done, and usually they're just small prospective studies. So the initial investigational studies on laser treatment showed an improvement in stress incontinence, but there weren't any control groups. The improvement looked like it was between 60 to 80%, and this was assessed using different questionnaires and pad tests. So a pad test is where you actually measure the weight of urine that's leaked onto a pad. It looked like the treatments did for 5 to 36 months. So, kind of short-term to mid-term range, but there were also few complications. And when we're starting to look at new treatments, this is really what we want, some indication that it works, but also something that has very few indications. Over time, some more robust studies have been done, and there was a study that came out in 2021 where they compared laser treatment to a sham treatment for stress urinary incontinence. And in this study, they found that more than 95% of women in either arm of the study continued to have symptoms of leaking with exercise after the procedure. And this was found at 3 months, so indicating that the laser really did not help with short-term urinary incontinence. Now, the one thing that I would point out about this study is that it was done with a CO2 laser, and so it may be that other types of lasers or a CO2 laser used with different settings might have different results. And so right now there isn't a lot of data supporting the laser for urinary incontinence, but different lasers, different settings may have different results, and there's more research that's needed to kind of figure that out. So moving on to sexual function and the laser. There is only so much data on sexual function, and a lot of times when there's limited data, we'll do what's called a consensus statement, where there are experts in the area who come together and kind of go over different statements to see what everybody agrees on. So there was a consensus statement that was produced from AUGS, which is the American Urogynecologic Society, and this came out in 2020. And they stated that laser has a positive effect on sexual function in the short term. The medium and long-term duration is unknown. So FSFI, which is the Female Sexual Function Index, which asks questions like, how often do you feel desire? How often did you feel aroused? Questions about lubrication and orgasm, as well as the frequency of intercourse, increased 1 month after the procedure and continued for up to a year. And there's no data at present on vaginal or vulvar appearances. And that's important to know because that is a very common claim or promise, and there isn't a lot of data here to support that. The one thing that I would point out about sexual function in the research is that, sexual function and dysfunction in women is complicated. It's physical, but it's also mental. If you believe things will be better, it often will. And one of the things that we've found in previous literature is that 67% of a treatment effect in female sexual dysfunction is accounted for by placebo. So it's hard to know how much the laser is actually doing in this situation. And while it may be a reasonable treatment, there also may be other cheaper alternative approaches for addressing sexual dysfunction. So that brings us to genitourinary syndrome of menopause. So initial studies here also showed that laser demonstrated short-term efficacy in addressing medical menopause-related conditions of vaginal atrophy and menopausal dyspareunia. But there were no control groups, and it looked like it lasted for about 1 year. This consensus statement, when they came together, they said that they feel like it's shown promise in the treatment of vaginal vulvar atrophy, dryness, and menopausal dyspareunia, right? So pain at intercourse at the time of menopause. That there were only small short-term case series with varying outcomes, and it looked like it was in the short term, right? So it wasn't a lasting effect, and it would need to be repeated. This randomized controlled trial that came out in 2021, they also looked at vaginal symptoms measured by analog scales and questionnaires at 12 months. And in that study, they found no difference between laser and sham, but there were an equal number of complications. So again, there's some promising initial data, but it didn't really hold up in a randomized controlled trial. And again, the question is whether it was this particular laser or this particular setting, or whether it just really does not work particularly well at all. So I'm going to switch gears here a little bit and talk about radio frequency, because radio frequency is different than laser. The technology is different. So radio frequency is an alternating wavelength current that is delivered by a specialized electrode. It can be monopolar or bipolar, and that energy travels across the tissue. The polarity or electrical charge of the skin is changed, and this creates heat in the tissue. And people who have had radio frequency can attest to this. You can definitely feel the heat when it is applied. Radio frequency bypasses the skin, and it's commonly used for skin tightening, collagen production, and body contouring by heating up and destroying fat cells. So what might radio frequency help with? The two things that it is frequently said to help with are sexual function and urinary incontinence. And there is biologic plausibility here for why this might work, kind of through the same tightening mechanisms. We'll just start with sexual function. So in 2017, this study came out, and it was in premenopausal women who felt that they had vaginal laxity, so that those tissues were pretty loose, and they were randomized to radiofrequency or sham therapy. And they noticed improvements in overall sexual function at 6 months based on these same questionnaires, the FSFI. And they also noted a decrease in female sexual distress scores. So 44% of the women women had improvement versus 20% in the vaginal laxity category. And then there was another study that came out in 2016, and in this study, women were dissatisfied with the appearance of the vulva, and they were randomized to either radiofrequency or control. And these women statistically noticed improvements in overall sexual function at 8 weeks after the therapy, based on these same scores, and also noticed an improvement in vulvar appearance, right? And that was 76 in the radiofrequency group versus 27% in that sham group. So there's some data on radiofrequency and sexual function, but I would not say it's particularly robust, but there's definitely a little bit more data there. And then in terms of urinary incontinence, I would say that urinary incontinence is not treated by radiofrequency. And the reason I would say that is really based on this trial. So the Viviv Medical Company, their whole business platform was based on using radiofrequency to treat stress incontinence. And they had a randomized controlled trial that came out earlier this year where they took 415 women and randomized them to radiofrequency or sham. And that trial had a null result. So, basically 50% of women in each group had a reduction in leakage. And that company has actually since become no longer a company based on the results of this trial. So I think that this is actually kind of definitive evidence showing that radiofrequency does not treat stress incontinence. So there's a lot of promise here, but I really think that it's a point where, the hope and the marketing has gotten ahead of the science, and what you're seeing and what you're hearing from people is either the result of very short-term benefit, or it's a little bit of overpromising. So going back to some of this ad copy, and this is what women are told and what they think they are getting. So why is vaginal rejuvenation right for me? Childbirth is very trying on a woman's body. Getting this procedure could be life-changing, help you with self-confidence, restore physical function as well. So, there really isn't data to support that. And this one, candidate for laser vaginal rejuvenation. Any woman who wants to improve the function and feel for her most intimate parts makes a good candidate for this procedure. Perfect candidates include women who've had a loss of vaginal tightness, suffer from vaginal atrophy or dryness, suffer from bladder leaking when they laugh or run, don't feel like themselves after menopause in terms of sexual gratification. So again, very vague, open statements without a lot of data to back it up. What can you expect after vaginal rejuvenation? So tightening and narrowing of the vaginal canal and opening, relief of pressure and discomfort through enhanced pelvic floor support. I would say there's no data for that. Boost sexual satisfaction for both the patient and the partner, right? Limited data there. And then improve self-confidence and body image. And, there's no studies showing that that's true at all. So the Mona Lisa Touch is a CO2 laser, and it was approved by the FDA in 2014. And when it was approved for incision, excision, ablation, and vaporization and coagulation of body soft tissues in these varying medical specialties. So no talk about incontinence or sexual dysfunction or genitourinary syndrome of menopause, but that's what it was frequently marketed for. And I'm just using this as one example. But then in 2018, the FDA came out and said that vaginal rejuvenation treatments might be unsafe. So there were a lot of concerns here that it was being used off-label, that it was being used in different spas that were experts in laser technology, but not necessarily in vaginal conditions or pelvic floor conditions. And so the concern here was that the manufacturers might be heavily promoting these devices for reasons that they could not justify, that there were more complications than were being reported, right? So basically more burns because the correct settings weren't used. And the big concern was that women weren't getting kind of the appropriate treatment that they needed. So again, misleading claims, done in a spa setting without access to full range of treatments, and that women may not be getting the appropriate treatment for their diagnosis, and that the full risks aren't known. So this statement came out, but it didn't really change anything, and lasers are, still widely used and still marketed in the same fashion that they have been, and same for radio frequency. So just to recap, with energy-based devices, so laser as well as radio frequency, they shouldn't be done on women with a pelvic malignancy, recent pelvic surgery, or an active infection, right? And I think that just makes sense, but those conditions aren't always screened for, depending on where you have it done. Women that have a lasering device or radio frequency should have a pelvic exam within a year just to make sure that everything is okay. And you can consider pre-treating with estrogen to enhance the procedure. The recommendations are really that these procedures are done by individuals with training in the relevant anatomy and by people who have demonstrated clinical competence, judgment, and experience in the full range of treatments for the intended condition, right? So if you have a laser for urinary incontinence and it doesn't work, that you can get another treatment, a different treatment, right, at that same place, and that before you have the laser, you're presented with all of the options that might treat incontinence. Not that lasering treats incontinence, but just so that you're presented with all of your options before you make a decision. So energy-based devices show short-term efficacy, and this is really about laser, and promise for genitourinary syndrome of menopause. They have a positive impact on sexual function in the short term, and there isn't any long-term data. Data on incontinence is really lacking or negative, as is in the case of radio frequency. But there's definitely a need for more research here. The thought is that these devices can help or maybe augment other treatments, but we don't have enough knowledge right now to really recommend them for most people. The other thing to remember about these treatments is that they're not covered by insurance, and so they tend to be very expensive. So women are paying thousands of dollars for these outcomes, which may or may not be reasonable, but should definitely be something that you know before you have the treatments. And then once again, they may be one part of the answer. I think that this type of treatment really appeals to a lot of people because there isn't any downtime, there aren't any scars, there aren't any incisions, but we need more information before we can really recommend it. Okay. Thanks for listening. If you want more information about me or my online work, check out my website at www.thewomensbladderdoctor.com.